Deep vein thrombosis is a common yet potentially serious disorder that occurs when a blood clot or thrombus forms within the deep veins of the body, most often in the leg. Although the condition may begin silently, it can have sudden and life-threatening consequences if the clot breaks loose and travels to the lungs, causing a pulmonary embolism. Together, deep vein thrombosis and pulmonary embolism are referred to as venous thromboembolism, a major cause of preventable death worldwide. Every year, hundreds of thousands of people are affected by this condition. It can occur in hospitalized or bedridden individuals, in individuals recovering from surgery or trauma, or even in healthy people after long flights or periods of immobility. The risk increases with age and certain medical conditions, but in many cases the disease strikes unexpectedly. Understanding how and why deep vein thrombosis develops is essential because early recognition and treatment can make the difference between full recovery and serious complications. In this video, we will explore the causes of this potentially dangerous condition, who is most at risk, how it's diagnosed, and existing treatment options. Deep vein thrombosis is characterized by the formation of a blood clot, most commonly in the deep veins of the lower leg, thigh, and pelvis, but it can also develop in the deep veins of the arm. Thrombi typically form in areas where blood flow is slowed or altered, such as near the valves of the deep veins in the legs. While venous valves can promote blood flow, they also serve as potential sites for thrombus development. The condition is usually a result of certain diseases, disorders, or extended periods of immobility. Deep vein thrombosis is potentially dangerous because a part of the clot can break off and travel through the bloodstream to the lungs, where it may block branches of the pulmonary artery, leading to pulmonary embolism, a life-threatening complication. Normal blood function relies on a delicate balance between the factors that promote or prevent blood clotting. The processes that favor clot formation are generally grouped into three categories: slow blood flow, a tendency to clot, and damage to the blood vessel wall. Of these, slow or stagnant blood flow is considered the most significant contributor to clot formation. However, this factor alone rarely causes a formation of thrombus. There must also be a predisposition to clotting or injury to the vascular wall. Conditions closely associated with thrombosis include major surgeries, trauma, prolonged immobility, heart failure, recovery from a heart attack, certain cancers, pregnancy, obesity, varicose veins, older age, and a previous history of thrombosis. The immediate effects of a venous blockage can vary in severity. In some cases, symptoms may be mild or even absent, if alternative veins can compensate for the obstruction. However, typical signs include swelling, pain, and redness of the lower leg, often accompanied by a sensation of warmth in the affected area. When the deep veins of the leg become obstructed, the calf muscles may go into spasm, leading to dilation of the affected veins and impairment of valve function, causing blood to flow from the deep veins into the superficial veins, increasing pressure within them. This elevated pressure causes the superficial veins to expand and lose their normal function. Over the ensuing weeks and months, the blood clot may gradually dissolve, but the damage to the venous valves and vein walls often persists, resulting in long-term venous dysfunction. In most cases, small clots that form in the deep veins of the lower leg resolve on their own. However, in some instances, thrombosis can progress to the veins in the upper leg. If left untreated, deep vein thrombosis poses a significant risk for pulmonary embolism, a serious condition that occurs when a part of blood clot, most commonly from the deep veins of the legs, dislodges and travels to the lungs through the bloodstream, blocking pulmonary blood vessels and leading to potentially fatal consequences. Additionally, individuals who have recovered from deep vein thrombosis may experience post-thrombotic syndrome. This condition results from damage to the venous valves, leading to chronic pain, swelling, and, in severe cases, skin changes or ulceration in the lower limbs. Deep vein thrombosis is managed by a vascular surgeon. The diagnostic process begins with a comprehensive clinical evaluation. The doctor first takes a detailed medical history, paying close attention to the patient's symptoms as well as any underlying medical conditions or risk factors. It is also important to review all current medications, as some drugs can influence clotting tendencies or interfere with diagnostic tests. When deep vein thrombosis of the leg is suspected, an ultrasound examination is performed, as this test usually provides a definitive diagnosis. To detect a blood clot located in the pelvic or abdominal veins, a CT scan may be necessary. A D-dimer blood test can also help with diagnosis. This test looks for a substance that appears in the blood when a clot is breaking down. If your D-dimer level is normal, it's very unlikely that you have deep vein thrombosis. However, if it's elevated, it doesn't always mean there's a clot. Other conditions, such as infection, inflammation, or recent surgery, can also cause high D-dimer levels. That's why the results always need to be interpreted along with the ultrasound findings and symptoms. The goal of treatment is to dissolve the blood clot, prevent pulmonary embolism, and reduce the risk of recurrent thrombosis. The cornerstone of therapy is the use of anticoagulant medications, commonly referred to as blood thinners. These drugs do not actively dissolve the existing clot, but instead prevent new clots from forming, allowing the body's natural fibrinolytic system to break down the clot. Anticoagulant therapy is typically maintained for 3 to 6 months, though in patients with persistent risk factors or recurrent clots, it may be continued for a longer period, sometimes even lifelong. Compression stockings create graduated pressure on the lower leg, which helps prevent blood from pooling in the veins. They reduce leg swelling and typically cover the leg from the toes up to the knee or the thigh. Compression stockings are usually worn for several months and sometimes even longer. Preventing deep vein thrombosis largely involves keeping the blood flowing properly through the veins. Regular movement and physical activity are key, especially during long trips or after surgery. If you sit or lie down for long periods, try to stand up, stretch, or walk every hour. Staying well hydrated, maintaining a healthy weight, and avoiding smoking also help reduce the risk. People with higher risk, such as those recovering from surgery or with certain medical conditions, may need to wear compression stockings or take preventive blood thinning medication as advised by the doctor. The deep vein thrombosis is more than just a blood clot in the leg. It represents a complex interaction between blood flow, vessel health, and the body's natural clotting mechanisms. What makes it dangerous is that it often develops silently without clear warning signs until a serious complication such as pulmonary embolism occurs. Fortunately, deep vein thrombosis is both detectable and preventable. Recognizing risk factors, encouraging mobilization after surgery or long travel, and promptly evaluating symptoms such as leg pain, swelling, or redness can save lives. Simple preventive measures, combined with appropriate medical therapy, remain the cornerstone of care. For those who have already experienced deep vein thrombosis, continued medical follow-up and adherence to therapy are essential to prevent recurrence and long-term complications such as post-thrombotic syndrome. Wearing compression stockings, staying physically active, and taking prescribed blood thinners as directed all play crucial roles in recovery. If you found this video helpful, consider subscribing to more educational content. Have a great day.